Welcome to Know This Live. I'm Zincle Esamwa. Joining me today is Dr. Anthony Fauci, the director of the National Institute of Allergy and Infectious Diseases, has been the leading health expert for Americans throughout the pandemic. He's also the chief medical advisor to President Biden. Dr. Fauci, thank you for being here with us.
Good to be with you. Thank you for having me.
Of course, and I want to start with the biggest news of the week, the Johnson & Johnson vaccine. As we know, there have been 6 known cases of blood clots, which caused really the halting of that vaccine being distributed. Given that, and that's out of the 7 million people who've already gotten the vaccine, more than 7 million, can you walk me through the balance as an institute for having to pause this J&J, knowing that it might increase hesitancy in the community?
Yeah, I mean, that's a very good point that a lot of people are asking. So, what happened is that there were 1 or 2 or 3 cases, and then as the CDC and the FDA, which monitor this very carefully for adverse events, saw 4 and then 5 and then 6, because of the serious nature of this particular adverse events, that is serious to the extent that it led to 1 death, 3 hospitalizations, 1 person in the intensive care unit. At an abundance of caution, what they wanted to do was pause, not cancel, but pause the continued distribution of the vaccine to take a close look to learn more about it, to see if there were more people that were going unnoticed. But also importantly, which I think the public doesn't appreciate, is that if there were a number of other people, which we don't no reason to believe there are, but in case there were, that physicians who would normally see people who would come into the office when someone comes in with thrombosis or blood clots, the standard way you treat it is with an anticoagulation called heparin. Unfortunately, that would be a bad thing to do because heparin paradoxically makes these people worse. So you wanted to let the people outside who might be seeing people like this, wait a minute, we think this is a very unusual, very rare syndrome, but if you're going to see it, don't do this, and to give the instructions. That's the first thing. The second thing, you can look at the hesitancy issue from 2 sides of the coin. You can say, at least I know when I go out and ask people why they're hesitant, not all, but many of them say, I'm worried about the safety of this new vaccine. So when you say we have a group of institutions, 2, the CDC and the FDA, that are carefully following the people who are getting vaccinated, and they pause the study, even with the rarest of rare complications, you can be sure that that same group is following all the other people who are getting vaccinated. And when we say a vaccine is safe, you can be absolutely sure it's safe.
Yeah.
Because even one that's a 1 in a million, we're pausing. So I think it might actually fortify the concept of how seriously we take safety and how the system actually works. That's the reason why they decided to temporarily pause this until they could investigate it more.
Yeah, and as I understand it, those 6 cases of blood clots were all in women. So should we expect guidance reducing availability of the J&J vaccine for women, maybe deterring or saying women should not get this vaccine as it poses a risk?
You know, it's entirely conceivable. It also could be restricted on the issue of age, because you remember that the age range was 18 to 48. So it might be, and I don't want to get ahead of the advisory committee on immunization practices, but it might be that there is no restriction, that there's a restriction on age, or there's a restriction on gender. I don't really know. We'll wait and see. That hopefully is forthcoming in the next week.
Yeah, we'll be watching for that closely. And another big question is, do you believe we'll still reach herd immunity given this challenge and the others that we've seen during vaccine rollout?
Oh, absolutely. You know, the United States has already contracted with 2 companies, Moderna and Pfizer, for enough vaccines to vaccinate everybody in this country. They have a contract for 600 million doses, so a prime and a boost. That's 300 million people. We have 330 million people in the country. And you would expect that not every single person in the country is going to want to get vaccinated. But in fact, we're going to have enough. And we also have contractual relationships with other companies, such as Novavax, which is a company that has a different type of a vaccine. And it is entirely conceivable, in fact, maybe likely, that we will continue to distribute J&J vaccine, which is a very good vaccine. So I don't think there's going to be any issue of having enough vaccines to vaccinate everybody who wants to get vaccinated.
And as you talk about supply, though, I'm mindful that hesitancy might be an obstacle. Are you worried that that will prevent us from reaching herd immunity, whether in communities, we've heard about communities of color, or even by ideology? We've heard from a lot of conservatives hesitant to take the vaccine as well.
Yeah, that's always a consideration. That's always something that we have to pay attention to. We have found that as more and more people get vaccinated, and as data come in, not only from the United States, but from other countries like Israel, of the extraordinary effectiveness of the vaccine, there are a lot of people who are hesitant because they like to, quote, wait and see. So right now, we have 77 million people who have been fully vaccinated and about 123 million who have received at least one dose. So the more and more people that get vaccinated, the wait and see people percentage gets less and less because they see as we go into this, things are looking really good. And in fact, on surveys of hesitant people, the percent that have been hesitant has gone down literally every single week for the last few months.
That's a positive development. And I know that even with the vaccines, however, we're still seeing more than 70,000 cases a day. How is this happening?
Well, that's one of the real frustrations that we have, and why I say it really is a race between getting as many people vaccinated as we possibly can and the virus, which, if left to its own devices, will continue to spread if you give it the opportunity to spread. And that is, again, something that is obviously controversial. There's no doubt about it. Is that even though we've been through this for quite a while now, 14 months or more, that people have COVID-19 fatigue. And you see certain states and cities pulling back on the guidelines and the mandates, saying, let's open the bars, open the restaurants, let's walk around without masks. Now is not the time to prematurely declare victory. Everybody wants to get back to normal. Everybody wants to get back to the normal life. But if we could hang on just a bit longer until we get more and more people vaccinated, we're averaging between 3 and 4 million people who are vaccinated every day. So every single day, we get 3 to 4 million people closer to getting the majority of the population vaccinated. When we do, you're going to start to see that level of infection go down. But it's kind of like a tension between people wanting to get out there and be normal and not wait for the vaccine to be the ally of keeping things under control. It's an understandable urge, but it is ill-advised to just lay caution to the wind right now. We need to hang in there a bit longer.
And I do wonder, what is your message to those experiencing pandemic fatigue? I think of the case of Michigan, which has been particularly worrisome. Governor Gretchen Whitmer wants a surge of vaccines available in the state, but CDC Director Rochelle Walensky said the state should just shut back down. So what do you say to those, not just individuals, but states wrestling with this issue?
I think it's going to be a combination of both. I mean, I think that Michigan is doing as best as they possibly can. It should be a combination of shutting down a bit more at the same time as you make sure that the vaccines that you have are expeditiously administered to people, and you don't have vaccines that are hanging around. In other words, if there are vaccines there that are not going into people's arms get them into people's arms as quickly as you possibly can, at the same time as you might have to temporarily, when people hear the word shutdown, what they think about is the year-long ordeal that we've had where the economy has gotten into a lot of trouble, where people have not been allowed to do the things they want to do. We're not talking about that now because we have something now that we didn't have last spring and last summer. We have a highly effective vaccine that every single day that goes by, we get more and more people protected. That's a big difference between now and last spring.
COVID continues to be the core issue and challenge that we're trying to face. What do you hope people have learned from the COVID-19 pandemic thus far?
Well, I think there are so many lessons learned here. One is something we've been talking about for so long, that outbreaks do occur. I mean, no doubt they do occur. They've occurred long before any of us were around. They're occurring now and they will continue to occur. And the biggest lesson is we've got to be prepared for the next pandemic outbreak. You can't predict when it will occur, but I will guarantee you that we will have another emergence of a brand new infectious disease, very likely jumping species from an animal reservoir to a human. It's happened multiple times, usually of no great consequence. But people ask me all the time, prior to COVID-19, what is your worst nightmare, Dr. Fauci? And I've told them, go back on all of the things I've said over the last 4 decades that I've been doing this. It's been my greatest concern is a new virus that jumps species from an animal reservoir that has 2 characteristics. One, it is highly adaptable and transmissible from human to human. And 2, it has the capability of a high degree of morbidity and mortality. Unfortunately for us, that's COVID-19.
How soon do you think we'll see the next pandemic?
Well, that's the point. You can't predict, and that's the reason why you've got to be prepared. It could happen next year. It could happen 20 years from now. We just don't know.
And you mentioned your greatest nightmare. I'm mindful that the last year was an intense one, especially for you. I know at some point you had security detail and receiving death threats. I just want to ask, how are you doing, both amid the pandemic, but just generally?
The death threats continue, but I'm doing fine. No, I'm actually doing fine. I've adapted myself to this. This is a surrealistic year. It's 24/7, literally 24/7. I haven't had a day off in 14 months, but other than that, I'm doing fine. You just adapt yourself to it. The problem is too immense and has too much implications. We've lost 560,000 people in America from this tragic pandemic. So I don't have any time to worry about how tired I am or how I'm feeling. I'll worry about that later.
Yeah, and I know, as you mentioned, it has been wide-reaching. How would you assess this administration's handling of the pandemic versus the previous?
I don't like to compare because then that becomes sound bites for people and creates things that I don't want to happen. But I can say that if you just look at the rollout of the vaccine, what has happened here within not yet the first 100 days of this administration, it has been really extraordinary. The president has literally on a daily basis all over this, following it carefully. We have a medical team made up of several people coming from different perspectives that are really full-time on this, with the president knowing about every single thing that we do, everything that's happening. So when you put full-time attention of the president of the United States, then good things happen.
I do know that something that is not happening yet is that kids are not being vaccinated. What and when can we expect that to happen?
Well, kids are vulnerable. You got to be careful. You talk about vaccine safety and hesitancy. The one thing you don't want to do is to do something to a vulnerable population like children until you feel comfortable that you're dealing with a safe and effective vaccine. So we're getting in that direction. Right now, You know, Pfizer has done adolescents from 12 to 15 years old, and they've shown that the vaccine is literally 100% effective. There were 18 incidents of COVID-19 in the placebo group and none in the vaccine group. Uh, Several companies, including Pfizer and Moderna, are doing what's called age de-escalation studies, namely studying it in kids from 12 to 9 years old, 9 to 6, 6 to 2, and then 6 months to 2 years. We anticipate that by the time we get to the end of this year and into the first quarter of 2022, that children of any age will be able to get vaccinated.
That's a promising development. And I know in that you referenced Pfizer. This week, Pfizer's CEO said that they'll likely have boosters within a year of getting the 2-dose vaccine. What do vaccines look like going forward, specifically for COVID? Will this be an annual vaccine?
We don't know the answer to that. There are two unknowns that we're preparing for, and I believe that is what Albert Bourla, who was the CEO of Pfizer, mentioned. It's the durability of the response, because when you get a response, it goes up, and after a while, it may start to come down. It may get below a critical level, at which point you're going to have to boost. He was saying that might happen a year from now. The other thing that might trigger the need for boosting is the appearance of different variants that you might need to boost against a particular variant that's out there, namely a strain of the virus that has mutated a bit to make it somewhat different than the original strain.
Thank you for that. And what are the biggest considerations and concerns looking ahead, right? Because if we're talking about vaccines, we're talking about potentially returning to the world as normal or our new normal. But what are the biggest considerations and concerns with approaching post-vaccination life, especially given the many variants we're seeing right now?
Well, you know, one of the concerns is that when you have a global pandemic, you have to get a global response. And even if we get the overwhelming majority of our people vaccinated and we return to a degree and a very strong degree of normality, which I believe we will as we get into the summer, into the fall, into the late fall, that will happen. We'll get back to the things that we like to do. It may not be 100% back to normal, but it'll be close enough that I think would relieve a lot of the stress that people are feeling. The problem that is a potential problem is that even if you contain the virus very well here in the United States, if you have the dynamics of an outbreak in other countries, particularly developing countries, there's always the risk of a variant coming back to this country and not being able to be well controlled by the vaccine that we're using. I don't think that's the case because I think our vaccines do pretty well against the variants. Maybe not protecting against complete infection, but certainly protecting against severe disease.
And do you have advice, just given your mass expertise around infectious diseases, on how to communicate to those who are still skeptical or reject the science and the importance of vaccination?
Yeah, I think you don't want to get into an argument with them or be confrontative. You just try and appeal to their reason and get it out of the political arena, because as you know, and you mentioned this yourself, it seems that some people don't want to get vaccinated are in a particular political persuasion. We've got to get away from that political thing and realize this is a public health issue that has already led to the death of over 500,000 people in America. We've got to do everything we can by pulling together to end this terrible pandemic, and we can't be fighting with each other and disagreeing with each other. We've got to pull together to end this.
And some have called, as you're talking about this atmosphere of divisiveness, I'm reminded of young people and the young generation, and some have referred to them as Gen C, as in those who have spent formative years in COVID-19. What do you hope that they learn from all of this?
Well, I think that what they should learn is that we are vulnerable and we've got to do everything we can to prepare for making sure that this does not happen again. There will be emerging infections for sure, no doubt. No matter what you do, new infections will emerge. The trick is, how do you prevent an emerging infection from becoming a pandemic? And if you're well prepared, then you may be able to do that.
Thank you. And I want to shift gears a bit. I know that you were the leading scientist during the HIV outbreak and AIDS epidemic in the 80s. And there has been a recent outbreak in West Virginia this past year that's gotten a lot of attention from the CDC. What do you think is behind this, and does it concern you?
Well, when you're talking about an outbreak, there are a couple of things. Usually, it right now today is either in people who don't have access to the testing and prevention. Right now, it is the drugs we have for HIV, AIDS are spectacularly effective, both for treatment as well as for prevention. So we know now that people who are at risk for getting infected, and in this country, it's very heavily weighted towards African American young men who have sex with men. And one of the reasons you see outbreaks sometime are twofold. One, lack of access to the kind of prevention, or needle sharing, in which you get a single situation where we had an outbreak like that some years ago in Indiana, where someone who was infected was using a needle and sharing it with people, and you had a mini outbreak in Indiana. We see that every once in a while with needle sharing, but we also see it sometimes when there's lack of accessibility to counseling and prevention therapies, such as pre-exposure prophylaxis.
Thank you for clarifying that for us. And as you talk about sort of a multi-pronged approach to infectious disease, I wonder if there are any other outside of infectious diseases. We've heard about the loneliness epidemic that America might be facing. Do any of those things concern you as a second tier or consequence of COVID?
Oh, I think we're going to have to spend a lot of attention on mental health issues that you are seeing already, but there will be a certain degree of post-traumatic stress, a different kind of post-traumatic stress, of people who've lived through a year of being uncertain about their jobs, of being uncertain about their health, of having their education interrupted. That is a big psychological stress on people. So I would think mental health issues are the things that I believe are going to be most compelling.
Absolutely. And part of that has to do with being connected. You referenced travel earlier and the concerns around that when it comes to spreading infectious disease. I wonder, would you travel for pleasure again, and how soon might that happen?
Yeah, I certainly hope I'm going to be traveling for pleasure again. Um, the CDC now has come out with progressively guidelines about what vaccinated people can do. It gets back to our conversation a few minutes ago. The more and more people get vaccinated, the more and more you're going to see an opening up of the flexibility of travel, both domestic and international. Right now, the CDC says if you're vaccinated, the risk of getting infected from traveling is very low. In fact, traveling on airplanes, particularly with the filtering system they have, even without vaccination, it's low, but you want to get vaccinated so you can make it very low and you can get back to traveling either for business or for pleasure, which I believe is going to be one of the positive consequences of more and more people getting vaccinated.
How likely is it that we'll be able to return to other things outside of travel? I'm thinking of baseball games, concerts, theater, entertainment that often involves mass gatherings.
I get asked that all the time. There are a lot of conflating factors that are going to modify the timeline. If all goes well and people seriously take into consideration the importance of public health measures and just don't throw them to the wind, as it were, and more people get vaccinated, I believe by the time we get into the late spring, early summer, and through the summer, you're going to start seeing a lot more people at ball games. You're going to see people in movie theaters. You're going to see people in entertainment fora. I will almost be certain of that.
But even in these settings, I imagine no handshaking, right? That's your stance? Is that still your stance, rather?
Yeah, I think handshaking is going to have a new connotation and place in society in future years. I know I'm not going to be that excited about shaking people's hands unless I was able to wash my hands every time I did it.
And I'll end by asking, so what will you do instead? Are you an elbow or a fist pump? What's your style? What do you recommend? Is there an official recommendation?
You know, there's no official Dr. Fauci recommendation on that. That's that's all we need. Just whatever you want. You know, elbow bump, fist bump, or just say, "Hello, nice to see you." I
Great. Well,
like that better.
wonderful. Well, thank you so much, Dr. Anthony Fauci, for your time, your insights, and all of your work.
Thank you. It's good to be with you.
Of course. And thank you to everyone for tuning in. This has been Know This Live. I'm Zincle Asamoah.